This is my presentation on necrotizing fasciitis, commonly referred to as the flesh-eating disease. This is a rapidly progressing bacterial infection that leads to the death of soft tissues. This disease spreads quickly and is considered a medical emergency that requires immediate attention. So today we're going to go ahead and explore its causes, pathogenesis, clinical manifestations, treatment options, as well as some preventative measures. My name is Leslie and I will be your guide through this discussion. Necrotizing fasciitis is a severe and life-threatening bacterial infection that destroys skin, muscle, and the underlying tissues in a really short period of time. Often it begins with just a minor cut or a wound, but then it will rapidly progress due to the bacterial invasion and the toxin release. Because mortality rate is so high if left untreated, early diagnosis and intervention are crucial. About 1 in every 100,000 people in the U.S. are affected by it. The primary culprit is group A, Streptococcus, but the other bacteria listed here can also contribute. Its mode of transmission is through contact transmission, which means it's going to be more of a direct person-to-person contact with the infected wound and then in some sort of injury. And injury can come through cuts, surgical wounds, or any type of blunt trauma. There are risk factors that include anyone with diabetes, chronic illness, someone who's had a recent surgery, and those that are immunosuppressed, because those with weakened immune systems are going to already be vulnerable to developing some sort of infection. The early symptoms of necrotizing fasciitis are often mistaken for less severe infections, which really makes early diagnosis difficult. The initial signs that we're going to see are going to be the intense pain around the wound, redness and swelling, and within a few hours that area may even become discolored. It'll form blisters and it'll have ulcerations around it. And as the infection progresses, you're going to end up developing a fever, low blood pressure, confusion, and eventually it'll lead to septic shock. And this rapid deterioration is going to lead to organ failure, which is why it's so important to have that aggressive medical intervention. So the Streptococcus pyogenes release a variety of exotoxins that contribute further to the tissue breakdown and the spread of the bacteria. And one of the key groups of the toxins involved is streptococcal pyogenic exotoxins. And they do two things. Typically, they do direct tissue damage, and it's when these exotoxins act as cytolins, and they break down host cell membranes and extracellular matrix components, and all of it leads to just necrosis, and it facilitates in the bacterial invasion into the deeper tissue layers. Another thing they do is immune system overstimulation. Some of the exotoxins act as super antigens, and it causes the system to bypass all of the normal immune regulations, and it excessively activates those T cells that results in this big cytokine storm, similar to like an inflammatory response that the body has. And this overwhelming inflammation, it damages the tissues and it leads to systemic toxicity. It can lead to shock, and it can also lead to organ failure. In addition to exotoxins, S. pyogenes produces these powerful enzymes that are known for breaking down structural barriers in their host tissues. Hyaluronidase. This is an enzyme that targets hyaluronic acid, which is a main component of the extracellular matrix. And once it breaks down that connective tissue, the hyaluronidase enables the bacteria to just penetrate deeper into the muscle and the fascia, and it just rapidly accelerates this disease progression. And then we have streptokinase, and this enzyme dissolves the fibrin clots that the host forms once your body starts to try to ward off the infection and contain it. By breaking down these clots, the streptokinase, it facilitates the bacteria's escape from that initial site of infection, and it allows it to just spread and disseminate throughout the entire tissues. And next we'll go over the cellular mechanisms. So one of the most critical aspects here of this infection is its ability to evade the host's immune response. And it just allows the bacteria to just multiply completely unchecked. And this occurs through several different ways. One is going to be the M protein and the phagocytosis inhibition. So the bacterial surface has this M protein that prevents the neutrophils and the macrophages from recognizing it and actually engulfing that bacteria. So it just allows it to further spread and thrive. And then we have the C5a peptidase and the complement disruption. And this infection, the S. pyogenes in particular, it secretes the C5a peptidase, which is an enzyme that degrades the C5a, which is a key chemoattractant for neutrophils. This limits your body's immune cell response to the site of the infection, and it's going to weaken the body's defense mechanisms. And then lastly there, we've got the neutrophil dysfunction and oxidative stress. So although your body's going to have some neutrophils that are being recruited to the site, once there is an excessive accumulation, it's going to lead to this overproduction of reactive oxygen and this inflammatory response. And instead of it like clearing the infection out, this is going to cause oxidative stress and damage on the body's healthy tissues. It's going to worsen the necrosis and create an environment that actually allows the bacteria to expand. The physiological aspects. As this bacteria continues to invade, it is going to lead to tissue hypoxia and eventually septic shock. The bacterial exotoxins and the inflammatory mediators, they're all causing this damage to your cells, and it's going to trigger this excessive clot formation in your vessels. And because now the flow is obstructed, oxygen and your nutrients, it's all going to fail to reach those infected tissues. This hypoxia is also going to weaken your body's immune system response and its ability to even respond effectively. So as this infection worsens, the bacterial components in the inflammatory cytokines are going to just infiltrate the bloodstream, and it's going to trigger this septic shock, which is a life-threatening condition. And this septic shock is characterized by uncontrolled systemic inflammation. So these bacterial superantigens, they're overstimulating your immune cells, and it's leading to this overwhelming release of these inflammatory mediators. And the inflammatory signals are causing your blood vessels to dilate, and it results in your blood pressure completely tanking. So now you've got hypotension in play. It's going to reduce the oxygen that's actually delivered to your organs. So as the perfusion is declining, organs like your heart, your liver, your kidneys, they're all going to start to fail. And without immediate intervention, patients are going to be high risk for death because the shock is going to be irreversible. When diagnosing necrotizing fasciitis, they're going to require a combination of clinical evaluations, laboratory testing, imaging studies, and even tissue biopsies for histopathology. Physicians are going to rely on clinical signs like a rapidly spreading tissue necrosis, the patient's in extreme pain, they've got systemic toxicity, and a blood test might reveal elevated white blood cell counts, increased C-reactive protein levels, and even metabolic acidosis. Imaging techniques like MRI and a CT scan can help assess the extent of the damage done to those tissues. Treatment of necrotizing fasciitis must be aggressive, and it's going to need a multi-pronged approach. The cornerstone management is going to be this immediate surgical debridement, where they're going to remove all the necrotic tissue and try to prevent further spread. In severe cases, the patients are going to need multiple surgeries and even limb amputations. They're going to need broad spectrum IV antibiotics to try to target that causative bacteria, which is going to be some sort of penicillin, clindamycin, etc. Other therapies that are being explored are hyperbaric oxygen therapy that has been shown to produce benefits for slowing bacterial growth and promoting tissue healing. The prognosis for necrotizing fasciitis truly is going to depend on how early it's diagnosed and treated. The earlier it's caught, your survival rate will be higher, but when there's delays in interventions and care, it's going to result in higher mortality rates, and that could be anywhere from 20 to 80%. Prevention involves proper wound care and maintaining good hygiene. You could also manage those underlying health conditions and risk factors. Ultimately, avoiding contact with those infected is going to prevent the spread. So in summary, necrotizing fasciitis is this fast-moving, life-threatening infection that demands immediate medical attention. This disease is going to progress due to the bacterial toxins and the enzymes, and it all leads to this widespread tissue necrosis and an overall systemic shock. So timely recognition, aggressive treatment, preventative measures, those are all going to be key for improving those patient outcomes, as well as increased awareness. And despite all of our current medical advancements and improvements in care, necrotizing fasciitis still has such a high mortality rate. And that concludes my presentation on necrotizing fasciitis. All of the information provided was based on peer-reviewed sources, including research articles and medical journals, all of which are cited here. Thank you for your time and your engagement.